Hi, I'm Anne Aslett. I'm the Chief Executive of the Elton John AIDS Foundation, and I'm here with Dr. John Wigg, who's the Chief Medical Officer of Walmart Health and Wellness. Let's talk about why the Elton John AIDS Foundation and Walmart are partnering together. What does that mean for you?
Oh, wow. I'm so excited about the partnership because much of what Walmart does is being in the community and being an advocate for those people that are underrepresented and not heard. And in a way, HIV is sort of that. It's always been a disease that people can't talk about or embarrassed to talk to people about. And so the ability to be able to partner with the Elton John AIDS Foundation and get into the community and talk about a disease that shouldn't be hidden is probably critical for me. It just touches a lot of who we are.
And from the foundation side, we were looking for an entry point or a footprint. Who was it who had some kind of scale? And many instances you think that's the health system, but actually, as we know, the health system isn't used or trusted by a lot of the folks that we want to reach. So it really does feel like a perfect match. And the fact that you have so many outlets and you have so many opportunities, so many people coming through your stores, and not something which feels scary in a health environment, but is where they buy their groceries, where they get their Christmas tree, is a really exciting and interesting collaboration, I think.
Yeah, I think to that point on scale, we have 4,600 pharmacies across the country. And there is a Walmart within 10 miles of 90% of the population. So you're going to come there. And many of the times, our pharmacists are really the first point for many of these folks who may not have insurance, may not know who to talk to.
So here we are on World AIDS Day, and I'm very proud to announce the new pharmacist training program that we're doing in collaboration with Duke University. This is supporting and enhancing the Ending the HIV Epidemic program in America, which is an HHS program. Tell us a little bit about the training.
Yeah, so the first thing that is critical for us is no matter where you are in the country, why shouldn't you be in a rural area and not have the same level of care that a major academic center? So the idea that we're both partnering with a leading academic institution means that somebody is going to actually benefit from that may not have even had the ability or the opportunity to have that type of guidance. That's the first piece. The second piece is that the training that we're trying to incorporate is going to be for all of our pharmacists. And while they're in the community and having that conversation, this is a complex disease. So there is the stigma of talking about the disease. There's being educated about sort of the daily habits that you want to think about when you have a disease like HIV, the different medications and the complexities of those medications. So trying to weave all that together and giving pharmacists an extra tool to do that is so powerful, particularly with people that might not even have that opportunity to be, talked to in that way.
And I know it's so exciting to be doing this and other programs where the foundation's worked in the UK and in sub-Saharan Africa. The critical thing is if you don't start that conversation right, you never get to deliver the information and the messages that you really have to deliver to help keep someone safe. So it's very exciting to be doing it. We're thrilled that Duke is a partner and that it's launching today.
I know, I'm very excited. The fact that we have 4,600 pharmacists, we have 30 health centers, and that we can actually get in and have that type of scale and impact, that in itself is going to be game changing.
Yeah, it's extraordinary. The scale is absolutely extraordinary. So thank you so much, Dr. Wigg, for joining me on this conversation on World AIDS Day.
And thank you for having us on this extremely important day. So thank you.